It's my feel-good breakfast show.
Now that is a smile and a face you can trust. Yes, the doctor is back in the house. Time to turn to health matters. For more than 2 years now, 2 years and a little bit of change, we've all been on, let's call it a very steep learning curve when it comes to COVID-19. The pandemic has certainly presented its various challenges on a number of levels, but as COVID-19 becomes a long-term part of our lives, what is that long-term map? We also need to focus on the fact that other preventable diseases are being neglected and diagnosed in their late stages because of the impact of COVID-19. To break things down for us is our good friend of the show and HIV and infectious diseases specialist, Dr. Emille Reid. Doc, you look special today. I don't know what it is. You look glowing. There's a special energy there. He does. You look younger.
Sure.
Could it be that today is your birthday?
It's your
Hey! Under the radar, he just slips in here. Maybe it's the Transkei vibes, as you were saying, that give it away. Happy birthday, my brother.
Thank you very much. I appreciate
I must say,
it.
thank you, man. You're sharing your birthday with the entire country right now, and remember, also tuning in around the world. So, not a
raise a glass of
day.
orange juice for the doc this morning, man. But
cheers.
We hope this year is in light of the last couple of years, for you especially, we hope that this one just eases off a little bit. Absolutely. And that you have everything that your little heart desires, man. You deserve it.
Thank you very much, guys.
Man. And again, of course, I'm always appreciative of having you in the studio. You've been feeding us with some incredible news, educating us on the pandemic, and it's still a thing right now. Obviously, 2022, COVID-19 is still real. You being a doctor as well, you've been having to adapt. I think with many people in the medical profession are adapting to voice calls, video conferencing. What's the knock-on effect of this when it comes to these changes within the way we are dealing with our health and the way we are diagnosing ourselves? Anything to maybe look out for, and what can we expect for the year?
Absolutely. I think the most horrible thing for us as physicians was not to see our patients. Yeah. Interaction is extremely important, taking a good history, and then to actually examine our patients. And in order for us to make an accurate diagnosis, you need to examine a patient. You need to listen to their heart, you need to listen to their lungs in order to decide what is going to be the next step in their management.
And there's got to be intuition, surely, because you're processing so much data when you assess someone. And there's so much of this open grey area that surely you need that. Just like our job, I need to look into your eyes. I need to feel your energy and feel your vibe, see where you're coming from, get that history. So now, not having that happen in many cases, what's the knock-on effect? Are we seeing certain diseases gain ground? What is the negative knock-on effect or repercussions of having this kind of distance, the space and distance between?
It's actually horrible, and one can actually see it between different waves of COVID, between the second and the third, and also between the third and the fourth. So people are scared to present themselves to their doctor. They actually stay away from going to a hospital, and we find that during the interval of our waves, people actually present with complications of their disease. Whereas, as an example, for instance, they probably had a cough during winter, could not see their doctor, was prescribed antibiotics on numerous occasions, and then it turns out they actually have lung cancer. So whereas you could have picked that cancer up as a stage 1 disease and offer surgery, you now pick the disease up with a disseminated disease. The same thing goes for high blood pressure, for diabetes, patients presenting with strokes, and during the time of winter, having had shortness of breath, people would think, well, I probably had COVID. Yeah. And then later on, presenting with tuberculosis. So a lot of diseases have actually been neglected during the course of COVID because the only thing we were talking about was COVID, COVID.
It's quite interesting you mentioned that. It's like, do flus still exist? Are you still able to get something like meningitis? It's almost like, if I don't have COVID, okay, cool, I'm fine.
Yeah, I'm sorted.
I'll just take a Panado, something crazy like this.
Exactly.
I must just say, speaking of COVID, speaking of some of the knock-on effects, obviously we have another chance to chat to you. What I'm really hoping to tackle later on is something I've seen becoming a trend, and that's long-term COVID. We've got another opportunity to chat to you in just a bit, of course, Dr. Emille Reid. I'm going to be chatting to him about this. Long-term COVID is something I've been hearing from a lot of people. Are you experiencing or not? We're going to dive right into that and a lot more about what we can expect when it comes to everything involving this year and our health. So we'll see you in just a bit. Carry on with this epic conversation.
It's my feel-good breakfast show.
Yes, you are just in time to continue our medical discussion, being a Tuesday. We love to delve into medical matters, and obviously at the moment we are firmly focused on COVID-19, as we have for the last 2 years, which have presented a various number of degrees of challenges for many people. But as we learn to live with COVID-19, there are many other issues that are presenting themselves, especially as more is learnt about the virus and the long-term effects on the body. I'm talking about long COVID. What even is that thing? We are back on the couch with HIV and infectious diseases specialist, Dr. Emille Reid, to unpack some more of these issues.
Birthday boy. Look, Doc, we were just touching on, obviously, COVID, some of the implications, and long-term COVID is something that's been coming up in conversation quite a bit. Is it an actual legitimate thing? Does long-term COVID exist, and what are some of the sort of symptoms of it? How do you know you have it?
Yeah, I mean, the important thing is we need to remember COVID is a dynamic field, so things sort of changes on a daily basis as well.
Yeah.
But long COVID or the COVID long haulers are those individuals who were infected with the virus, and usually after 28 days, so 4 to 6 weeks afterwards, they are still suffering with symptoms of COVID. And those symptoms are extremely important because people are not going to work, people don't feel themselves, people cannot focus. And the majority of cases we see with long COVID have symptoms, for instance, like fatigue, headache, inability to smell, inability to concentrate, inability to sort of taste. And that is horrible. And that is a legitimate thing, although we don't know the etiology or the reason why it happened. But about 15% of people who suffered from COVID develops long COVID. And that's another reason why we want people to vaccinate, because people that are vaccinated have up to 84% lower chance of developing long COVID.
So just to clarify, when someone has long COVID, it's the experience of the symptoms. They're not infectious for a longer period of time.
No, they're not infectious. It's just symptom-based. And I mean, it's quite difficult because you actually don't know where to start.
How do you treat it?
How do you treat it? Because we don't know what the cause is. So the biggest thing when treating long COVID is to actually see your doctor, and then for your doctor to decide where to refer you based on your symptom complex.
So I'm going to ask you a question now. It's probably not really your speciality, but you would have, because you've been on the front lines, you obviously work very closely with your patients, and I would imagine you've been able to get a bird's eye view, if you will, and thought a lot about the socio-economic impact of COVID-19. In your experience, what sort of knock-on effects, as we kind of move through the spectrum of knock-on effects here, what is this having on communities out there? How much of a knock has COVID had?
Well, COVID had a massive knock. People lost their jobs, people lost their lives, but people also lost their livelihoods. So if one look at the socio-economic impact of that, it can be virus-related, which is disease-related, and then also non-virus related, which is people not being able to go to work, people isolating, people going into quarantine, people working from home, kids that are not able to go to school.
Yeah, what do
I mean,
parents do?
it's a horrible, horrible negative impact of COVID on our communities.
Like it affects the system completely,
Yeah.
and then it's
Yeah.
all just about surviving.
Yeah.
Speaking of this, though, I mean, there's small amounts of people in the community that have obviously suffered from certain things which I believe are not only long-term effects, but certain effects that I believe are irreversible. Is this quite a common thing that we're experiencing now? And what are some of those effects that are appearing to be reversible, essentially?
For sure. And I mean, there are a lot of people who sort of believe that, well, COVID is nothing. If I get COVID, I'm going to recover completely. Unfortunately, we don't know who's going to be affected negatively and who's not going to be affected negatively. So yes, you might get the virus and then survive, but then you suffer of debilitating long COVID symptoms. On the other side, people that was hospitalized suffer something we call severe lung fibrosis as well, to the point where their lungs are damaged irreversibly.
Sure.
And they need to be referred to a transplant center to get on a transplant list. And the same happens if somebody develops inflammation of the heart or the kidneys as well. They need to be referred to a long-term care facility to facilitate transplantation of their kidneys or transplantation of the heart. And then something important is that because of the treatment of COVID and the fact that there are receptors to the virus also on your pancreas, we actually find that there is a massive increase in people who had COVID suffering from and being diagnosed with diabetes along the line and after they had COVID in the last 3 to 4 months.
Crazy. I think for me, the take home here is if you are experiencing shortness of breath or any symptoms that are having you feel in any way a little bit anxious, don't wait. See a health practitioner and at least start that conversation so that we can avoid many of the long-term dangers that we have spoken about. Doc, thank you so much. Happy birthday once again. We absolutely love having the doctor in the house. And hopefully this has enlightened you just a little bit, talking about some of the more long-term effects of COVID-19.
It's my feel-good breakfast show.
Zanzi, welcome back. Your Feel Good Breakfast Show, opening up and educating you on everything when it comes to your health, because we got you covered. Now, as COVID-19 progresses, of course, and continues to make headlines around the world, there are certainly some strange and interesting stories that are emerging. Now, we thought it might be interesting to get a doctor's input on some of the comments we've been speaking about. Of course, Dr. Emille Reid, it's not only your birthday, but it's also a day that we always get to be educated by you. And I think you give us some sort of comfort, just in terms of knowing, understanding what's going on. At the same time, you offer resolution, which is so important. So it's not just about the fact that we're left with the problem, but you do provide that direction for us. And I'd got to just say thank you for that, because I really think in a time like this, Mzansi especially wants to band together and just know that they're doing the right thing, especially for their health and their family, man.
And we need that. I think the biggest killer has been the uncertainty around all of this. I think it really has pushed people beyond the brink. So let's round off with a bit of an assessment of where we are right now. What are the numbers like? Are we moving out of the current wave of Omicron? And how should people be feeling about where we sit?
Well, guys, I think we can actually be comfortable with what's happening around us. With Omicron being a very transmissible virus, we expect numbers to rise dramatically, as been happening in the UK and in the US as well. But there's going to be a decoupling of, for instance, the numbers and the hospitalization rate as well as the deaths. Meaning that we should probably not focus on cases anymore, but we need to focus on hospitalizations and death. Meaning, as sort of immunity increases through natural immunity and vaccination, we can actually sort of go from a pandemic to an endemic phase and learn to live with COVID-19.
And do you think that's where we're at now? Do you think we are in that phase of moving out? I don't want to speak too soon, but
I do think we are. And I think we need to now sit together and plan our future, living with COVID, and kids need to go to school. This alternative day of going to school need to be stopped. Ventilation in classrooms need to be improved. Teachers need to be vaccinated, and life need to go on.
All right, well, look, it sounds more promising than anything else, but what is the reality of that? I mean, we're talking about moving from a pandemic to an endemic. Certainly a positive thing. What does it actually mean for us, though?
Well, the most important thing is for people to increase our immunity through vaccination. And as that immunity sort of increases, we will find that even though the virus is more transmissible and is immune evasive, the amount of severe disease, illness, and complications is quite low. So we will have, like the flu, that influenza is an endemic viral disease. COVID will probably become similar to that. So when we get our influenza vaccine on a yearly basis in the high-risk group, we will probably get a COVID jab for those at high risk, not for everybody. That's what endemic entails.
V Day is coming. What that V stands for is up to you, but please go and get vaccinated if you can. Doc, always an absolute pleasure. Really interesting discussion this morning, and happy birthday. You can send Dr. Emille Reid a happy birthday message on social media.
Thank you.
But another great discussion. Hopefully you garnered some gems out of that one.